Hey everyone, it's Dr. Rick, and today's unboxing is on Canna Drops. Canna Drops, found at Zen Leaf, according to a patient of mine, and that's a tincture, a CBD dominant tincture of medical cannabis. There is also Verilife, Pharmacanis has Madder, Tangerine, different strengths, and then there's my go-to Avexia Relief tablet form. So, if this is the first time you're finding me, don't forget to hit the subscribe button down below and the alert button to find out when I do new videos. So this Canna Drop thing, it is important to understand exactly what we're doing with dosing. So I'm not sure if you can see this. That is the dose, or that is what we have as far as, it doesn't come into focus, but I'll just go ahead and break it down. So this is about, I believe, 40 or 50 bucks if I'm not mistaken, and it comes in a tincture. Let's just smell this. It has a little bit of a marijuana smell, but the terpenes, they're not that strong. And this is the dropper. So the dropper is divided into 1.0 milliliters, 0.75, 0.50. So maybe you can see that. And it should be easy to find or see. You can see there's a meniscus in there now. And that's the level of the fluid in the dropper. And essentially all you do with this is you take 0.5 of a dropper, put it under your tongue, let it sit there for about 30 seconds to 2 minutes, and it absorbs underneath the tongue into the mucous layer and then into the bloodstream and straight to the brain or straight to the desired CB receptors. CB1 are mostly stimulated by THC. CB2 receptors mostly stimulated by CBD. So I don't want to, if you're a beginner, I don't want you to get confused, but what we're going to talk about is how to get high dose of CBD without too much of a dose of THC. It's unless you go with hemp, it's impossible to just get CBD. You can go with a topical. I think there is one topical that's mostly CBD, and that probably won't get into the bloodstream anyway. But we're talking about trying to take care of or reverse or fight autoimmune disease like rheumatoid arthritis, Hashimoto's thyroiditis, Crohn's disease, multiple sclerosis, or even just pain, back pain, knee pain, headaches, joint pain, or even rashes like psoriasis and eczema. So if you do the right amount of CBD to load up, and everybody's a little different depending on the patient. And this also helps, I believe it does help with panic attack, depression, and post-traumatic stress disorder too. The folks with anxiety, panic attack, or PTSD probably would benefit from having a decent amount of CBD in the system, because it certainly doesn't really, now those of you who say that CBD is not psychoactive, I beg to differ. I think there's going to be some psychoactive properties to CBD, cannabidiol. Classically, cannabidiol is only going to be on the CB2 receptors. The CB2 receptors, I essentially say, are everything from the neck down. CB1 receptors, neck up. That's why if you stimulate CB1, you'll get a little bit relaxed, old-fashioned high, calm. If you're a PTSD patient, you'll turn off the panic attack. If you're an anxious patient, you'll turn down the anxiety. If you're depressed, they'll actually help improve mood, depending on, again, what you have. Now, if you are doing everything else, and I will get to the how of the CBD in a second, but most people that have mood disorder will have an extreme presentation that interrupts the way you drive, that interrupts the way you interact in society. Your activities of daily living can be impaired if your mood is either too high or too low. And that's where we want to get that sweet spot in the middle, but it's hard to figure out who needs what kind of dose. There is cookbook medicine that'll help you figure out. Here's a table from just the prescription CBD THC products that are made by the government, and it gives you a dosing system, but these are heavily refined and they are prescription. So there are a few prescription medicines that are available for some patients. I think it's cancer, nausea, vomiting, cachexia, or HIV, wasting. So aside from those, I don't think you'll have the prescriptions covered by insurance. And the other thing is, people that I've seen use the prescriptions don't really like them. I think when you refine a plant and you try to suck out the exact active ingredient, you might not get the same reaction as getting the whole plant. And obviously smoking the whole plant or eating the whole plant, as far as medical cannabis, is fast and classic. But now that we're talking about trying to overlay it onto a working society to take care of autoimmune, chronic pain, debilitating disease, cancer, and or mood disorder, you have to refine it a little bit. So if you're, without speaking about hemp, because hemp is pure CBD, if you're going to try to get to a medical dispensary in Illinois, I think there's a couple of different options, and that's why I wanted to talk about this. I'm glad my patient brought this in. So tincture, I think, is really good. The only problem with tincture is that you have to be comfortable with putting the oil under your tongue. So the way this works is you suck up a little bit into the desired amount. I would say 0.25. So if I just adjust this a little bit, tap down the bubbles, see the problem already? You can, that's off already. So 0.25 has to be like the first hash mark. So you have to kind of dial it in. You take that, you get it dialed in, and you put it under your tongue. Once you put it under your tongue, you keep it there for about 30 seconds to 2 minutes at the most. When it comes in contact with the bottom of the tongue, as long as there's not too much film, it'll be absorbed into the blood vessels under the tongue and then straight into the bloodstream. And once it gets into the bloodstream, it'll work its magic. If it's mostly CBD, and Spectra or Canna Drops has mostly CBD, it's 54% CBD, 7.63% THC. There's also 23% CBDA. So there's a nice breakdown of the percentage. If you calculate it out, 0.5 of this, of the Canna Drops, 0.5 is equal to about 3.3 milligrams of CBD. And that's what we're trying to talk about here is CBD. So 0.5 of this twice a day will get you 3 milligrams twice a day of mostly CBD. Now, if you do 3 milligrams twice a day, that's pretty good. I think that's a decent amount. I'd like to do 3 milligrams 3 times a day. Now, just as some books put, if you are fighting cancer, I would let loose and get up to 300 milligrams combination THC, CBD as best as you can tolerate per day in divided doses. That's going to be a lot, and it's going to be very expensive, and if you choose to do it via the smoke or inhalation type, smoke or vape, or volcano, you're going to be high, and that's what I call a whoa effect. Usually if you take your product at night for sleep, for insomnia, and you wake up in the morning, you're like, whoa, I think that usually means you're either too THC heavy with that dose or too high with that dose. Too high meaning high dose, not high like in psychoactive. But that is going to be the complication with using 2 different products. However, again, just for the sake of our discussion today, with my autoimmune, my cancer, my back pain, my knee pain, my orthopedic pains, and my mood patients, I would rather have you all have a little bit of CBD twice a day to 3 times a day if you're rich in your bloodstream for the rest of your life. I think it's just very beneficial. I think it just helps. The problem is if you're already on a lot of medicines like seizure medicines, this has to get broken down through the liver's cytochrome P450 pathway, which, not to get into the weeds, but that's how the body eliminates this. It's also the pathway that a lot of your medicines for mood, seizures, a lot of medications will go through that same pathway. So if you're taking this and you think you're perfect on your medicines and you're dialed in, you have to be careful about dialing this up and dialing these guys down and watching your liver. Hopefully a good doctor can watch your medicines. There's no great test for the level of blood CBD at this point in time. Hopefully there will be one of these days. There is testing for THC as far as drug tox, but it only tells you whether it's positive or negative. It doesn't tell you the exact amount. It's coming, but it's not here yet. So the only thing we can go with, if you're a physician or if you're a patient on those medicines, especially seizure medicine, is to check a level, especially if you're on something that has carbamazepine or Tegretol. The other psychiatric medicines, the clonazepams or the benzodiazepines, if you are on seizure medicines, hard to measure, but I think a good doctor can still help you dial that in properly. So how do we get the CBD in with either of these 3 products? I'll start now. So I already talked about doing this 2 to 3 times a day. There's 32 mLs in here. And a 1 dropper full is equal to about 6.5 milligrams of cannabinoids. So if you just break that down into half a dropper, you'll have 3 milligrams. I think I mentioned that you should do 0.25. Here you should do 0.5. I'm sorry, take that back. You should get the half a dropper, 0.5 on the dropper, and you do 0.5. That's to the hash mark right there. I don't think you'll see that. But 0.5 is right there. You do that twice a day if you're lucky and it can afford it, 3 times a day. That'll give you 3 milligrams 2 to 3 times a day. 2 to 3 times a day is pretty good for 3 milligrams. It'd be nice if, again, at cancer, there's some literature that says 100 to 300 milligrams a day, that's essentially divided by 3 because it's easy dosing that way, is max dose for helping with fighting cancer or stopping metastasis, especially the ID1 gene. But that's another talk. As far as just getting an amount of CBD in your system 2 to 3 times a day. So this will last you a month if you do half a dropper 2 times a day, maybe 3 times a day. It'll give you 3 milligrams twice a day. That's pretty good. Total of 6 milligrams in one day, pretty decent for the $50. Now that's, I think, from ZenLeaf, the close to me. There's other ones. Most of my patients are either ZenLeaf or Verilife. This is from Verilife, and this also has hash marks on it. And if you pick half a dropper of this stuff, this will give you about 10 milligrams in a half dropper. But this is only 25 doses. So I'd want you to, for $35, I want you to make this last. And it's a lot. 10 milligrams is a lot. So you can actually break it down into 0.25 ml. That's a 0.2. This is the one that's 0.25. This one's 5. So 0.5, 0.25. So hopefully I'm not getting everybody confused, but 0.25 will make this last about 25 days, and you'll get in about 5 milligrams per dose. That's pretty good. Remember, this is 3 milligrams twice a day, 3 times a day if you're rich. This is 5 milligrams twice a day, so you're getting pound for pound more, but this only lasts for 25 days. This lasts for 32 days. So 5 milligrams, I would choose that. 3 milligrams, and sometimes depending on the amount of THC, and they both have different amounts of THC, you might have that cumulative effect, the entourage effect of both the CBD and THC, but I'm just talking about the basic building blocks of getting as much CBD on a regular basis in your bloodstream. So this has 16, make that less than 3 milligrams of THC, so you probably won't have any effect. It's almost like hemp. This has 7.63% THC. I'd have to calculate that out. So let's just leave the THC out of it. Let's just talk about the CBD. So higher dose, a little bit more short-lived, 25 days, $35. This one's a lower dose, 3 milligrams, 3.3 milligrams, pretty decent. It's honorable. Twice a day should be fine. 32 days it'll last, but it's $50. This is my go-to tablet because some people don't like oils. They don't like keeping oils under their tongue. This tablet, if you take a half a tablet twice a day, will give you 1.25 milligrams of CBD. And there is a tiny, tiny bit of THC in here. It would be 0.09 milligrams THC. So essentially negative or 0. But half a tablet of this will last you 40 days for $35, and you'll get 1.25 milligrams of CBD. So you can see 1.25 milligrams CBD, 3 milligrams CBD, 5 milligrams CBD. 1.25 twice a day, 3.3 twice a day, 5 milligrams twice a day. This will last you 40 days, this will last you 32 days, this will last you 25 days. So you can make the choice as far as which dispensary you're going to. You always switch dispensaries too to find your product of choice. I can probably expand the zoom on the footprint of dispensaries in my area, but Verilife and ZenLeaf are both the most popular ones in my area. And you'll have to switch. So that is it in a nutshell. I would say you're not really, although I said before that I believe there is some mild psychoactivity, calming effect, or mood boosting effect with just putting CBD in your system. Just look at all the anecdotes of people using hemp. Hemp is really all CBD, effectively. And there are some people that say they feel great, and they continue to feel great. I believe that that could be placebo, but placebo, in my opinion, usually fades off by about the second month. I don't have patients fading off. I've got a couple cancer patients taking care of nausea. I have a lot of patients taking care of sleep. They're usually combining this baseline amount of CBD with a THC product at night or during the day. For my PTSD guys, my vets, my panic attack patients, they will probably go for fast acting. In addition to the slow background noise of CBD, they'll do fast acting, which is usually inhalation, smoking, vaping, volcano, which is fine. But at this point in time, in the month of October, the CDC hasn't finished their investigation as far as the e-cig problem. I do have a video on e-cig versus vape. I think that you'll find that they'll probably fix things about the co-ingredients in the liquid of the vape. At this point in time, nobody has said anything about the smoke from a single hit or a bowl or shatter as far as smoking. I don't think that's the wisest thing. I think it does, the data, this is a small book, but the data does say that the cannabis plant does help with lung disease like asthma. If you say asthma is an immune attack, maybe from leaky gut or not, but the problem is the vehicle, the way you get it in. The smoking can actually irritate, or this high temperature of the vape and the vaporized smoke or the vaporized product, that too can irritate you. So you have to be careful. Until the CDC has finished their vaping thing, and until we have enough data that says that smoking doesn't really relate to tar and doesn't cause long-term cancer, I don't think it will. But I just say it probably, there's so many different options orally or with edibles, concentrates. I'd rather have you do this. It is a little more expensive, but I think there's less side effects. Going through the digestive tract is a little bit unpredictable. That's where this tablet comes in handy. So it depends on if your stomach is full, if you take it with a fatty meal, if your stomach is empty, if you have alcohol. I would try to do the tablets on an empty stomach as best as you can twice a day. I think that you'll have more reliability and predictable dosing. As far as the sublinguals, doesn't matter what you're doing as far as your eating habit. Since it is sublingual, it bypasses the stomach. Now, those of you who keep it under the tongue for 30 to 90 seconds, you will eventually swallow it, and then it will go through, at that point, it won't go straight into the bloodstream, it'll go into the liver. The liver will break it up, and it'll have to undergo first pass effect, which degrades it. But there's also going to be bioactive components after the liver takes care of it, so it'll give you a prolonged amount of an effect later on, instead of like the vapes lasting only 1 to 4 hours. This stuff will make your vape last longer, or this itself will last longer because it's oral. There's also gummies and a couple other things, but the best way, I think, the best products I've seen locally for CBD are these. Don't forget, if you are a supplement person, or if you do have deficiency, I would take care of the deficiency because there is an entourage effect. I always suggest DHA. You don't have to do vegetarian DHA, you can do your own DHA, fish oil. I don't think krill oil has a measured amount of DHA, but I like the vegetable part. DHA helps calm, helps boost the effect. Probiotics help boost the effect, especially if you have a gut-related issue. Even if you don't have leaky gut, if you have an autoimmune disease, I believe autoimmune disease and leaky gut go together. So if the gut is working better, the autoimmune disease is under control, but the gut will work better when you do probiotics. And probiotics also benefit with this, as far as cannabis, and the cannabis also is accepted faster when the probiotic and the microbiota in your gut are working properly. I think there's also an entourage effect if you have your terpenes in the area. Pine is, this is what makes people like to go hiking in the woods or in nature therapy, because it makes you settled. But it also will make this plant will make this plant go work better because of the entourage effect. This is also a terpene. And then finally, if there's new data that says pregnenolone also helps boost the effect of THC in a way that you don't get high. That whoa effect that usually happens in the morning when you kind of get up and you're like, oh, whoa. You're still dizzy, you're still forgetful, you're still fatigued. that's high. And if that's the case, you can rescue yourself from too much of a THC effect by having the CBD in you. That's why I'd say load up with CBD first, then you'll be able to dial in your THC. Now those of you who are really anxious, you might want to get started on THC first and then maybe CBD. Those of you who are just using this for sleep, you might not need the CBD, but I think this is helpful for everybody for life. This plant is spectacular. Kind of like taking turmeric and its benefits, which we're assuming, like in the continent of India, the lowest ever statistically significant population with Alzheimer's. And it can be attributed to several different things. There's a high pollution rate there, but maybe it's the yoga, maybe it's the mindful practice, maybe it's the majority of vegetarianism, maybe it's the turmeric. But when you take the plant turmeric and you try to extract the active ingredient, which you think is the best, curcumin, and you put curcumin into a bottle, it might not work as good. I think there's enough robust information that says it does, but I'm just using that as an example. So when you take the plant, the leaf, the trichomes, and you know that the active ingredient of this plant is spectacular, and you assume it's the CBD, and you try to get the CBD into a bottle, sometimes you don't have the whole plant effect. That's why it's nice to have something with a broad range. So if your products that the companies or cultivators are refining are too refined, number one, they're going to be really expensive, like the patches or the topicals or some of these tablets, the gummies or the candies or the chocolates. Number two, you might water down the effect. But here's the benefit: when you process the plant, instead of smoking or vaping, you can actually dial in without having that whoa effect in the morning or after you get a hit. One hitter or a bowl. You have to be careful, and they're going to start probably testing for intoxication sooner or later. I don't know how they're going to do that, but I heard the highway system is thinking about doing that. But I think that if you can dial in your CBD dose first and do it for life, 2 times a day, maybe 3 times if you're rich, then you load up on the other things, you'll have a better entourage effect in addition to your supplements. So hopefully this gives you a little bit of an idea about what to shoot for. You always have to do some reading. Leafly is excellent. I have a couple other cannabis books. Medical cannabis is fantastic. I think it can be used as a medicine. Those of you who are waiting for recreational to come around in Illinois on January 1st, you are not going to have. If you qualify, I'd rather have you get a card. Yes, it does cost you money compared to recreational, but check out my video. I don't remember the name of it. I'll try to search and put a link down below. Recreational gets taxed higher, up to 25% per purchase, versus medical, 1%. Recreational has a limit to the THC, so if you're hoping to just go from street THC to recreational, you're not going to have the same choices. So medical has unlimited THC and unlimited CBD and more products. The other thing is, if you wait for recreational, if there's a glut and the cultivators haven't caught up with the purchase or the demand, if you go there and there's only one product left, but there's a medical cannabis card holder and a recreational card holder, or a recreational user, the medical card holder has priority. He gets the product because the dispensary is considered a pharmacy because of the license they were given. The pharmacy has to have medicine available for the patient list, and if the patient list is large, they have to have a reserve for all those patients because it is medicine. Now, those are the basics, but there's a couple other benefits to have the card too. So I would say know your product, know your ratios, know the active ingredient, know what you're trying to shoot for, and have somebody guide you. I like a lot of the patient care advisors, or what some people refer to as bud tenders. I think they're very experienced as far as anecdote. They might not have the same knowledge base as I, but they know what most patients shoot for. The only problem is most patients in Illinois aren't being guided by a doctor. And I think I have a vast amount of knowledge of the way the human system works, the way psychology works, the way mood works, and the way these things interact with supplements and prescription medicines. So you can certainly read a lot of this or watch a lot of videos, but there's something about assimilating the information that I think you should get from a doctor. So just be careful, be a good shopper. I always tell my patients, if you go to CarMax or a car dealership and you just have all this money and you don't have a car, you know you're going to leave that day with probably no check and a car that you can drive home. But if you're really anxious to get a car and you have a lot of money, you're going to give the whole check to the salesman. So if you go, same thing as a candy store. If you go into a candy store or grocery store hungry with a certain amount of money, you're spending the entire amount of money because you're hungry. If you go into a medical dispensary and you're in pain, or your mood is terrible, or your autoimmune disease is just flaring up, you're going to probably, and you have $1,000, you're going to probably spend $1,000. So be wise with your shopping, research beforehand, get on leafly.com, get some books, watch some videos from reliable instructors or doctors. And I like Mara Gordon. I think she's awesome. She doesn't have, she's essentially a cultivator. Aunt Zelda's out of California has been using it for a while, and she actually applies it to different tumor types, different cancer types. I like her work. I like her information. She's actually funding now. Aunt Zelda's is funding more information since NIH won't fund any studies because it's still Scheduled 1, which is no medicinal value and highly addictive, which I totally disagree with. But if you, 2020 is going to be voting season, so if you can get whoever your politician is to vote and get it off the schedule, that'd be important. So that should drive you in addition to everything else that's complicated. So hopefully this gives you a hand. Thanks for watching up until this point. If you have any comments on how you guys dialed it in, or if your dispensary has something totally different as far as CBD, please put it down below. Otherwise, I'll see you at the next unboxing.